Hey, KB here, aka Ryan. So, uh, this is gonna be my message to the rehabs and any facility treating drug addiction or alcoholism. Okay, so I know a lot of drugs are um, are an issue, and that they're all dangerous and they're all addictive. And so, my message to you guys is this: is that the world is is being hit with this meth pandemic, epidemic, whatever you want to call it. And what I found is that when you call a rehab, and some ask you your drug of choice, some don't, but most do, and you tell them meth, you tell them your drug of choice was meth, they treat you a little different. So I asked myself, why? It's really silly, if you ask me. Um, I don't care about research. Who cares about that? Our literature says that any addict can lose a desire to get high, can lose the desire to get high, and find a new way to live. So, with that said, you guys are dead wrong for treating any patient because of their substance or their choice of substance to use any different than the next person that uses something different. There's no difference. There's no difference. It's just our reaction to the drugs. That's it. Some have a lower bottom than others. Some have a higher bottom. Some only have to lose a relationship. Some have to lose everything. Um, some resort to robbing and stealing to get their drugs. Some don't. It's just the way it is. So you shouldn't be treating patients that come through the door any different from each other because of their drug of choice. It's just absolutely ridiculous. And I don't care, again, what the research says. It doesn't matter. Because if that addict has a willingness to get clean, he needs to be treated. He needs to be treated. You're not going to pass you're not going to pass on a cancer patient that has a different cancer than this other cancer patient. This cancer patient has lung cancer, but this cancer patient has pancreas cancer. Oh, well, those don't survive as long as these or have a good enough chance to survive from that kind of cancer. So we're going to go ahead and treat this kind of cancer and not worry about that one. It's absolutely absurd, right? So when you put it in that sense, it doesn't make sense, does it? So, this is to any rehab center, any hospital, any place designed to take inpatient patients that are dealing with substance abuse or alcohol abuse, and just take it from a recovering addict. It's ridiculous when you call a place and they treat you different because you were addicted to methamphetamines. It's ridiculous. So please take note of this and stop pushing patients away because of their drug of choice. It's not right. And that's really all I got to say about that. So take care.